Today's food environments exploit people's biological, psychological, social and economic vulnerabilities, making it easier for them to eat unhealthy foods. Child obesity is a serious global public health challenge and is a risk factor for several other non-communicable diseases. Portugal is no exception and has shown one of the highest prevalence of obesity among children in Europe, with more than 30% of children being overweight.
Modern societies are now facing new and serious problems. We all know the importance of non-communicable diseases, not only in developed countries but also in developing countries. That is the reason why Portugal considers as a central issue of the health policies the fight against childhood obesity. It is necessary to protect our children and our youth.
Joining the WHO European Childhood Obesity Surveillance Initiative, COSI, in 2007 was a golden opportunity. Monitoring the prevalence of overweight and obesity among children has contributed to a downward trend on childhood overweight and obesity over recent years in Portugal. COSI supported the Portuguese government in defining childhood obesity as a national priority and putting forward several bold measures. Portugal has already taken action in fighting childhood obesity. The data provided by COSI was essential in engaging and committing not only the Portuguese Health Ministry, but also all the other government ministries. The Portuguese government published the first integrated strategy for the promotion of healthy eating, mapping out more than 50 concrete measures to be put into place.
One of the biggest challenges of implementing effective public health policies is that most of the times, not all the members of cabinet share the same priorities. If we want to make real change in childhood obesity, we have to bring all the ministers together and make them commit to a common strategy to promote healthy eating and fight obesity. It wasn't easy, but after 1 year of discussions inside government, we made it. We committed all around one shared strategy, focused on public health.
In Portugal, children and adolescents are the main consumers of sugar-sweetened beverages. Thus, implementing a tax on these drinks was extremely urgent. The Portuguese sugar tax on soft drinks was implemented in January 2017, and data from the first year of implementation are already available. Demand for sugar-sweetened beverages decreased 7%, contrasting with the increasing trend over the previous 4 years. A significant share of demand for sugar-sweetened beverages shifted to water. Sugar contents of sugar-sweetened beverages reduced more than 15%. Following the implementation of this tax, the food industry became more open to collaborating with the Ministry of Health.
In Portugal, we believe that this agreement with the Portuguese government will be the best way to tackle this problem, even on the childhood obesity or in the adults' obesity. So we are concerning about this. We are pushing all the companies at national level. We are fixing targets for reformulation, and we believe that Portugal could be a good example for Europe and even for the world.
For the first time in history, the Portuguese government will sign a reformulation agreement with the food industry in order to reduce levels of added sugar, salt and trans fats in processed foods.
We first congratulate the Portuguese government for introducing a tax on sugar-sweetened beverages, which is considered as one of the most cost-effective intervention or best buy by the World Health Organization. Now, this tax will achieve a lot of health benefits in the country. And the proposed new agreement between the government and the industry to reformulate food products to reduce unhealthy nutrients such as sugar and salt will also bring huge health benefits.
Following the implementation of the tax on SSBs by the Portuguese government, the WHO predicts that a total of 27 deaths will be avoided or delayed every year. There is no doubt that this is an amazing achievement. However, the co-regulation agreement between the Portuguese government and the food industry will have even more significant health outcomes. The WHO predicts that this agreement by itself will avert 873 deaths.
By working together, we can get the world moving and create a healthier future for our children. Portugal can be a model in this movement.
Regulation isn't the only tactic to fight non-communicable diseases. Last month, the Portuguese government announced the integration of 40 additional nutritionists into primary healthcare units. This way, the Portuguese NHS will be better equipped to support children and their families in fighting obesity.
Legislation alone is not enough to change lifestyle. That's why, side by side with all health eating initiatives promoted by the government, it is important to improve health NHS workforce. To hire more and more nutritionists is a crucial part of the solution. Recently, the government announced the hiring of 40 new nutritionists for the NHS. It is a historical move.
The food system is an interconnected network of producers, industry and institutions, with the individual at its heart. Therefore, the Portuguese government, in collaboration with industry and civil society, has been taking decisive action in order to influence a cultural shift towards healthier food preferences, in order to create a society with healthier people, a society with happier people.